Thank you, of course, to all the organizing committee for the fantastic hospitality and to have invited me and the emergency. And I'm sorry for Dr. Gino Strada, he cannot be here today. He's the founder of our NGO, which was born in 20 years ago. He's now in Sierra Leone, where we have another hospital, and is opening 100-bed hospital for Ebola patients, which is really a social emergency now in Sierra Leone, like in West Africa. Our NGO was born 20 years ago for the surgical treatment of civilian victims of war and landmines. And of course, at a basic aspect, promotes a culture of peace, solidarity, and respect for human rights. So, why? Because of war, of course, particularly in modern wars, 90% of the victims of war are civilian, and of course, war and poverty carry social and sanitary emergencies with a great lack of acceptable level medical facilities and trained staff, with lack of effective long-term programs. So we have many hospitals in the world. Two are not, the one in Iraq, in northern Iraq, Kurdistan, and the one in Cambodia have just been handed on to the local authorities after the end of our training. And so we have 3 hospitals in Afghanistan, and this is Afghanistan, I will speak about that. Then we have a hospital in Sierra Leone, in Central African Republic, and a particular hospital which we opened 3 or 4 years ago, the Salam Center for Cardiac Surgery in Sudan, in Khartoum, which is the only one where we are not dealing with war surgery, which is what we do in all the other hospitals. So Afghanistan is a particular country, of course, and we know that 30 years of war in Afghanistan carried a lot of course, dead civilians, but not only 3 million of disabled and amputees, because there are a lot of 3 to 5 million of landmines and 5 million refugees. So really it's a social emergency with the poverty carried by the war, we know. And we already heard about that early in the first presentation. For sure, surgery is a kind of neglected stepchild of the global health, but for sure we know that surgery has now an important role in the public health strategy in a lot of areas, and particularly also in injuries. In the Eastern Mediterranean region, where Afghanistan is, the burden of injuries by external causes, you can see that war and injuries is the main one. And if we look at the future, the percentage of surgical dailies from 1990 and to 2020, we see that the increase in the injuries and in the war is much higher than other basic specialties. So, and of course, in Afghanistan, as in other countries, emergency and essential surgical services are still missing. The limited access to surgical services and peripheral health facilities should be a global concern, and the availability of basic and emergency surgical care is far from being satisfied in a lot of countries, but particularly also in Afghanistan. But surgery is so important, it has been added as a chapter in the CDC book, but we have to shift a little bit from the traditional mindset. I mean, the surgeon is the one who is going abroad and provide surgical services, to the new mindset where the surgeon is just the provision of training of surgical services, which is kind of different. So which are the basic points of our intervention? The basic points are to try to keep high standards of cure completely free of charge for everybody, to guarantee access to the poor and to vulnerable groups and to treat everybody. For example, in Afghanistan is tribal, different religious, ethnic groups. So one of the main points of our intervention in Afghanistan is that we have always treated everybody regardless of sex, age, political and religious issues. So to work in close contact with local authorities to guarantee the ownership of the project with the final goal to leave them to the project to run. And we try to invest on infrastructures. So we try to build or rebuild the hospital and we run then completely. I mean, we don't support then. We run our hospital trying to keep a sustainable and effective management. So we ask the donors and the partners the commitment to reach the poor and to pursue the goals of the global health, ensuring equity. And we try to implement effective monitoring mechanism of the standard of care. And this is also a very important point. We provide high-level training for local staff and develop residency and fellowship programs. And in Afghanistan particularly, we will see that we developed a quite unique system of referral of the patients to the main hospitals because Afghanistan is such a difficult country also from the geographic point of view. Of course, we use very simple protocols. So this is the memorandum of understanding we have with the Ministry of Public Health and the admission criteria. So we are treating war-related injuries and landmines injuries. Of course, we also treat emergency patients that are in life-threatening conditions that come in our hospitals. We just treat them, stabilize, and then refer to other hospitals. We will, of course, accept anybody who is in a life-threatening condition. And, of course, we take care also of the post-surgical rehab. And we also have a réseau of many what we call first aid posts disseminated in all the country. And in one of our hospitals, we also take care of OBGYN, antenatal and neonatal care. So we have 3 hospitals in Afghanistan, the one in north of Kabul, Anoba, which is the first one that we opened 20 years ago, more or less, 15 years ago, more or less, one in Kabul and one in Lashkargah, which is in the Helmand region in the south, more or less near the Iran border. So the first hospital we opened in 1999 in the Panjshir Valley. It was a former military compound in the village of Anoba, which was renovated and turned into a surgical center. These are the data updated until now. So it's of course, now it's a region of Afghanistan where the war is not active, not anymore. So during the years, it was a little bit renovated. So we opened also what is now a maternity hospital where we do OBGYN, maternal and pediatric intervention. And this, we are very proud of that because I can tell you it wasn't very easy to have local people, Afghan people, to take their wives, to have their children born in hospital run by male, not Islamic Christians. So it was very difficult. So we are doing now more than 10 deliveries per day. So it's a very, very hard work. So we have the 2 main hospitals that we have, one in Kabul, opened in April 2001. It's 100, more or less, 100 beds. And of course, here we only deal with war surgery victims. And just to give the figures, these are the figures in 2014, just updated until the end of September. We did almost 3,000 operations only in this hospital with almost 2,000 admissions, and only during the month of August, we did more than 500 operations only in 1 month. The third hospital is a 80-bed hospital in Lashkargah, in the south Helmand region, where the war is more active, and also figures more or less the number of patients admitted and treated until now, since its opening in 2004, are pretty impressive also. So we try, for example, Lashkargah is the only one that we completely built ex novo. We built from zero, while we already talked about Anoba, and also the Kabul one was rebuilt. It was a former elementary school from the Russian period. So the hospitals should be completely self-sufficient. So we have a pharmacy, we have the laundry, we have a carpenter, we have the maintenance, we have everything. Of course, we have generator, because in this region, particularly in Lashkargah, electricity power is lacking for at least 12 hours during the day. All our hospitals have the tents for the mass casualties always active, because this is very frequent that happens in Kabul and in Lashkargah. We have gardens and we have playgrounds for the kids. Over 50% of our patients, of course, they are not pediatric, but they are youngsters, and unfortunately. And this is upper left side. This is one of the wards of the Lashkargah hospital. The OT, of course, sustainable means between sustainable and high quality standard of care, there is a little bit of a difference, because we have, as much as possible, high-level care, but keeping something which is sustainable locally. I mean, and then we stay there for a long time. In this case, in Afghanistan, since 20 years now. So we have to keep the thing. If an equipment is broke, we have to be able to repair locally. So otherwise, it will not work. So. But in Kabul, which is a little bit easier, we even have a CT scan, which once was the only CT scan present in Afghanistan. Now there are many others, but this is the only one free of charge for everybody, of course. And we have a former intensive care unit with 8 beds of intensive care for mostly post-operative patients. Another very important point is, of course, the teaching for local personnel. So we teach not only the local doctors, we have Afghan doctors in all of our hospitals, which we support, and we also teach to the paramedics, to the nurses. We have a program, we teach English and also paramedics. So now, after 15 years, we are really proud to say that we have our 3 hospitals are recognized training centers from the Minister of Public Health of Afghanistan. So we receive in our hospitals Afghan residents for the surgical training, surgical trauma residents. You can see the first to have graduated in our Lashkargah hospital. And also we have Italian residents, last year's residents in general surgery, who do their rotation in one of our hospitals and do their final thesis in a study that they did in one of our projects. So. And also we are organizing, with the partnership of WHO and European Commission for Aid and MOPH, basic trauma course held in Kabul. We train almost 200 local Afghan doctors doing this basic course. So one of the other main points is that it's Afghanistan for more than 50% of the region is over 2,500 meters above sea level, and it's rural, it's very poor, so pre-hospital trauma system reduced trauma mortality for sure, and where out-hospital times are long, basic life support measured by trained first helpers and paramedics are life-saving. So when you are in such a setting, of course, this is the road from the Kabul hospital to the Anoba hospital in the north, and where it's difficult to go around for you that you have a car, and most of the people doesn't, of course, and during the winter it can be very, very, very freezing, and also complicated by the fact that going around there is a war, so this is what you have. And we developed a network of what we call first aid post or PHC, primary health clinic, in order to provide treatment to the people who are injured far from our main hospitals. And so together in Samara, around Kabul and in all Afghanistan. So local staff trained by emergency provide basic health care, first aid, and referral of patients in serious condition. We have a hospital, so we take them like this from local authorities. We transform them like in the upper right, and we put personnel, of course, paid by our NGO, paramedics and medical personnel, along with an ambulance which is present 24 hours a day, every day, to refer the patients that need to be transported to our main hospital. And we have 30 of them scattered all around Afghanistan. This is a Google map of Afghanistan. Many of them in really very remote and far areas. The key point is that to keep their trained trauma nurses present anytime with medical material, basic, and a dedicated room for the emergencies, and an ambulance present 24 hours a day, 7 days a week. So for a trained trauma nurse, all the nurses that are working in all these first aid posts are getting a proper training in the 3 hospitals that we have. So they are able to identify hypovolemic shock, to resuscitate and fluid replacement skills, to immobilize a fracture, even spinal or also pelvis, to control external bleeding, to do the basic wound treatment, at least at the beginning, and to perform a GCS evaluation for the head injury patients. And then the patients that need to be transported, they are carried in our hospital. So an ambulance with medical material, very basic, the same for every ambulance that we have. Of course, an ambulance with a nurse present to perform reevaluation and treatment, because, of course, an ambulance without a nurse is just like a taxi, just a little bit more comfortable. But this is how the patient normally arrive in our hospital. They just get in the car, they do sometimes even 3, 4, 6 years of going around in these conditions without a drip, without liquids, without anything. So for sure, we try to change them, and then in the end, which is doing that, this is the end point, and by that we reach to refer to our surgical centers by all these FABs that we have all around Afghanistan, about 25,000 people. And only Only in Kabul and Lashkargah from 2011 until 2013, we increased steadily the number of patients referred from the rural areas to the main hospital. So, as a total, in general, in these 15 years that we've been in Afghanistan, we treat over 1 million of outpatients, over 100,000 admissions with 100,000 operations, and 25,000 children born. For sure, we know that working in this low resource country can be tough. Accommodation sometimes is not, for sure, is not the same that you have at home, but this is everywhere. The day in OT can be very long. And for us, it's very difficult, particularly at the beginning. Even if you do a polytrauma patient, you do your general surgery, you repair the intestine mostly, or the liver, and then you have the vascular surgeon that comes and fix the vascular problems, or the orthopedic surgeon who fix the bones. And then there you finished, and then nobody arrives. And then who takes care of the fracture? Who takes care of perhaps of the head injury? You have to take care of everything. So it's completely different kind of surgery. So it can be quite hard. But if you think that only in 2011, Italian government spent about 350 million euros for what they call to be a peace intervention. If you see the picture, it seems more like a war intervention to me. But in the same year, to run the 4 emergency hospital, emergency spend only 5 million euros. So for sure, then you think of all the patients that you treated, adults, but also mostly, I would say that because more than 50% of the patients we treat in Afghanistan are children, for sure, I would say that it's highly rewarding, and thank you very much for your attention.
Dr. Maurizio Cardi, thanks a lot for your presentation. Impressive numbers, especially. I was wondering, I had one question myself. It was just interesting. It is quite impressive what you receive, and especially this idea of giving the highest standard care that you can possibly deliver is a very beautiful approach, I think. And you tell us that some of the hospitals, you handed it over to the local authorities after a couple of years. Can you tell us something about how successful that is? Because you can imagine that in some circumstances it's quite difficult for them to deliver the same quality after you have left.
Yes, for sure. It's very important, because we always say that the ideal goal for us is not to exist. First of all, because it means that there is no war, because we do only war surgery, more or less. And second, because we handed to the local government all our projects. We managed until now to do that only in two cases. One, it was a small project in the first that we had in Iraq, and the other one quite big. It didn't take a couple of years. We handed over 2 years ago, but it was open since 10 years. It was in Battambang, in Cambodia, a center that dealt with mostly with treatment of landmines, which were very disseminated in Cambodia, and now it's a former trauma center handed to the local government. Of course, when we speak with Afghanistan, for now, really it's very difficult, because it's a very poor country, and I think that only one generation of people who work in this hospital is not enough. They work for different reasons than we do. We are we normally, when we work, we try to enhance our skills and to always to do better. They work to survive. So they work for the $150, $200 you give them, with which they are able to run the families. And so to hand it over to them, I'm sure if we leave Afghanistan now, for example, in a couple of weeks, this will be exactly as a local hospital. So for now, this is not possible in Afghanistan, but the goal is this one.
Okay, thank you. Thank you.